Welcome everyone. My name is Sarah Burtis and I work for the Grand Valley State University Battle Creek Regional Outreach Center. I'm here today to teach a little bit more about the basic foundational skills and needs and educational pathway needed to becoming a nurse. If you missed our first career exploration video series on careers in education, feel free to check out our website and our YouTube page to learn a little bit more about careers in education. But this quarter, we're going to focus on nursing and all the careers within nursing. So make sure you watch this whole video to compete and complete this video's challenge to earn yourself a GVSU prize. And then if you're watching this video on YouTube, please give us a big thumbs up to show us that you learned something new today. Thank you. Let's take a look. I say the first step in any career exploration task is to really dig deep into what the actual job responsibilities of that career choice are, and then as well as what skills are needed, and then do some reflecting and do I have the skills needed to be successful in this career, and are these job responsibilities something that I want to do day to day, and does it bring that passion out from me? So as you look at these limited bullets for nursing, because I know nurses do so much within the healthcare system, I chose specifically these bullets to share with you today because of the themes that I see and the connections between them. So with the job responsibilities, you can see in every bullet, it talks about patient care. So I foresee nursing being kind of that liaison between the patient and the doctor, and they have a strong voice in that collaborative discussion on the best treatment for that patient. So to do that, you want to be comfortable working with people, but also have that personable, friendly, interpersonal skill to speak with empathy and speak clearly and work collectively with a team to advocate for your patient's needs and the proper treatment needed. The second task I ask people to do is to look at the job outlook for that career. So as you can see for nursing, in 2019, it is projected to have a 7% job increase. You can see there it says the current nurse shortage because of COVID or other situations that have caused a strong need for nurses in this point in time. So that just is really great to know as far as job security. So you go through college, you get your degree, you get your license, and it's most likely you could get a job easily because the percentage of the job increasing, and because of the current shortage, you would be able to be successful. Then also, you can't ignore the fact that you're going to be an adult and you'll have to be financially independent. So looking specifically at the state of Michigan, for a registered nurse, on average could make yearly or annually $73,000 a year. Now that might be high or low, depending on how much work experience you might have, and then as well as where you might be working. Some facilities have a little bit more money, other facilities have less. So that really does determine on your annual salary. And then you can see it jumping up a little bit there in the state of Michigan for a nurse practitioner. And that's higher because a nurse practitioner requires more education. And you'll find that with most of your careers that you might explore or might be interested in as well, is that with more education and more experience, you do end up making more money. So make sure when you are looking at job outlook and the salary that you just don't get turned off right away, because most of the time you will increase your annual salary from year to year with job experience and more education. As mentioned in the previous slide, I mentioned a nurse practitioner and a registered nurse, but I'm going to share two other professions within the nursing field today and a little bit of the background information on where these specific nurses can work, and also some of the education that might be needed to be successful or to achieve this license. So if we're looking at registered nurses, more than 60% of the registered nurses were employed in hospitals in 2016. So I know that was a little bit ago, and so I'm sure it's increased by now. But they also have jobs in doctor's offices, outpatient facilities, nursing care facilities, and many other places that require nurses, correctional facilities, and even a school nurse. So you would need to acquire the BSN, which is a Bachelor's of Science in Nursing. That's a 4-year degree or a four-year institution, four-year degree. You can get that at Grand Valley State University or any other four-year university that has that program. You could also get an ADN, which is an associate's degree in nursing. And an associate's degree typically is 2 to 3 years, and you can get that certification through Kellogg Community College, our local community college here in Battle Creek. But you do need to take a state licensing exam to maintain your certification to become a registered nurse. When we're talking about nurse practitioners, they mostly work at family healthcare centers, but also within hospitals as well. So to have an RN, you must have a state license, and while they're going back to school to get their nurse practitioner's degree. And that would be working towards a master's or a doctorate in nursing practice. So most RNs enter the profession by completing this master's degree, but some choose to get a doctorate as well, which is a DNP, so a PhD in doctoral nursing practice. Then we have a nurse anesthetist. An anesthetist is a nurse that really supports doctors that might be providing a treatment that might be painful. If you've ever heard of anesthesiologist or anesthesia, it is some form of inhaled gas or some sort of drug that can help limit the pain that the patient is feeling through a procedure. And again, this would be a registered nurse license, and some people are working towards their master's as a nurse anesthetist through that program, which is also supported at GVSU. Nurse faculty. So nursing education professionals must have that comprehensive understanding of what that field really requires. So a lot of people who have gone through their nursing program and have worked as a nurse in the field sometimes want to go back to a higher education institution and really support the programs to really bring a new generation of nurses into the field that are stronger and better. You would need, after earning a BSN, so your Bachelor's of Science in Nursing, and becoming a licensed registered nurse, the next step on the path of becoming a nurse educator is to obtain an advanced degree, and that can come in a form of a Master's of Science in Nursing degree, an MSN, or like we mentioned, a PhD, a Doctor of Nursing Philosophy, or a Doctor of Nursing Practice, a DNP. So a lot of acronyms, but you can see that you start with a registered nurse and then you can increase your education, which will also allow you to find your specialty within the field of nursing as well. The last step that I suggest for people who are trying to find the right career path for them are these 3 steps. Obviously, job shadowing. When you job shadow, you get a better feel of what that environment is, the day-to-day duties, the atmosphere in which you're working. So you really get a full picture of what that job really does entail. In nursing interviews, when you can interview an actual nurse from different environments, you get to learn more about the whole picture of that career again, which means you get to not just learn from the good, but the drawbacks as well. You will want to learn the drawbacks for any job that you might want to look into, so you can kind of gauge the drawbacks to your personality, your drive, your interests, and your values, and if that can kind of balance itself out. And then the last piece of this puzzle is research. Always learn what you're getting yourself into. With the price of school and the time committed to the nursing career, you will want to learn the whole path needed to be a successful nurse. And watching this video is the very first step of learning just the basic foundational needs and requirements to becoming a nurse. Thank you all for watching and learning more about the nursing profession in our career exploration video series. This was the first video that kind of gave you a little brief understanding of each of the different nursing careers that are out there. In the next 2 videos, we actually hear real testimonials of active nurses in the field right now, as well as we'll hear from GVSU and KCC on certain programming. So what educational path do you need to take to becoming any of these types of nurses? So I appreciate your time in watching these videos. Remember that this video's challenge is just to simply like our page on Facebook. It's at GVSU BCROC, that's GVSU BC Rock. Once you like our page, you can come by our office to pick up your GVSU swag item. We love to meet our community members and our active participants in our video series. And remember, if you have any questions, feel free to reach out to me at the email and the phone number on your screen. And don't forget to check out our next videos. And if you're watching this video on YouTube, please like this video so we know that you learned something new today. And that is all. So be well, be safe, and Laker up, my friends.